I think that the idea that this is going on in A&Es up and down the country in modern Britain is scandalous. And then you add the gigantic waiting list, heading towards 8 million people on waiting lists in this country. And the NHS is a brilliant system once you get to the point where you're getting the care. But getting to that point has become a national disgrace.
Piers joins us now to tell us all about it. Piers, good morning to you.
Well, you might have run away, but it's quite clear that your co-presenter would have stayed, maybe a nice cup of tea, and welcomed me in, like the friend that she is.
I think that's probably right, and you're absolutely right about my position as well. Now, listen, Piers Morgan, what was it like? 'Cause Rishi Sunak doesn't give that many interviews. He doesn't give that many long interviews like this, and he's in a lot of peril at the minute, a lot of political peril, written off by all and sundry. So before we get on to sort of the details of the conversation, you've been around prime ministers. You know what they're like when they're in trouble and when they're confident. What was his demeanour like? How did you judge the body language?
I got the feeling, because I interviewed him a year ago, just after he come into the office, and I think then he was like all new prime ministers, very, bushy-eyed, bushy-tailed, and bright-eyed, and ready for the great excitement of being prime minister. And then, of course, reality hits you. And I say to him at the start of the interview, the best description, I think it was Jim Callaghan who once said that being prime minister, to start with, it's like being in a choppy ocean. You get hit by wave after wave after wave, and you think, my God, I'm drowning. And then you realize over time, it's always like that. That's the job. And then you start to navigate and work the waves. Now, the problem Rishi Sunak is he hasn't got that long to be prime minister if he was to lose the next election. So he knows that. So he knows he's inherited a pretty big hospital past. And to be fair to Sunak, when you look at what's happened to him since he became chancellor, he becomes chancellor, and then literally that month we're hit by a global pandemic, the worst cost of living crisis in living memory. There's a war breaks out in Europe again, first time for many decades. Then we have another war in the Middle East, and so on and so on. It is a pretty unprecedented period for any government, actually. And so I think he acknowledges it's tough times. He wasn't making excuses, but I do think, to be fair, you have to say, look, this is very, very difficult for anyone, and it will be if Keir Starmer becomes the next prime minister. I got a feeling of someone who's got a bit steelier in his year in office, who's now got used to people hammering him all day long, and I think he's got a pretty thick skin as a result, albeit with the thin skin that comes from when you're reading about yourself all the time. Part of me is like, why don't you all just leave me alone? But I think my reading of Sunak is, I think he's a thoroughly decent guy. I think he's very hardworking. He's teetotal. He gets up early. He goes to bed late. He works hard, but he is facing a very difficult challenge to try and stay in office, and we'll have to see. And of course, part of the interview was to judge him on his 5 big pledges. If you go through,
hold that thought. Yeah, hold that thought, because actually, we were very struck by a line you got out of him on one of those key pledges. One of which is, of course, about this one. It's the health service.
NHS waiting lists.
We have not made enough progress.
You failed on that pledge.
Yes,
because you said NHS waiting lists will fall. In fact, they are slightly coming down now, but the waiting list is still nearly 500,000 more than it was at the start of last year. You accept that?
Yes, and we all know the reasons for that. What I would say to people is, look, we've invested record amounts in the NHS, more doctors, more nurses, more scanners. All these things mean that the NHS is doing more today than it ever has been, but industrial action has had an impact, and that's why we've been working very hard to bring down the people waiting for A&E.
Thing is, Piers, a lot of ministers come on this programme and would go a long way out of their way to avoid admitting they've failed on something. And I just wonder whether is he just trying to clear the decks with that one, because you can't argue with the numbers. The numbers are the numbers. But that's a very key admission, isn't it?
Well, it is, and I actually applaud him for the honesty, because you're right, a lot of politicians would try and squirm their way through it and come up with excuses. He didn't, actually. He just took it straight on the chin and said, yeah, they haven't done it. And we go through the other 4 pledges, and we're going to air all this at 2:00 on the Piers Morgan Uncensored YouTube channel, and you can see how his answers play out. Look, it's difficult, like I said, and I think that on the NHS in particular, I said to him, look, I've had a very personal experience with the NHS 3 months ago when my mother had a heart attack. Now, thankfully, she's back to normal now and got fixed by a brilliant care system once she got into the cardio unit. But getting down there through A&E was utter hell. You know, she spent, having been told she'd had a heart attack in our local hospital, blew lit in an ambulance down to Brighton. She then spent nearly 7 hours on a trolley in a corridor. And not just her, she was surrounded by dozens and dozens of other, mainly elderly people, most of them on their own. At least my sister was with my mother. But, you know, it was absolutely horrific in there, like a war zone. And I think that the idea that this is going on in A&Es up and down the country in modern Britain is scandalous. And then you add the gigantic waiting list, you know, heading towards 8 million people on waiting lists in this country. And the NHS is a brilliant system once you get to the point where you're getting the care. But getting to that point has become a national disgrace.
Yeah, and he'll be judged by that. But whether anyone else can do anything about it, we've been talking about the Times Health Commission today with some of the plans.
Yeah.